Showtime.
Go ahead, Luz.
All right, let's begin. Thank you for joining us today for our Black History Month Mental Health and Testing final discussion panel. Before we continue, I would like to remind everyone to please mute your microphones and turn off your cameras in order to avoid background noise and not affect the bandwidth. You will get an opportunity to ask questions. Our moderator will let you know when. Please note that we are recording this discussion in order to continue sharing this great event. My name is Luz de los Reyes. I am an Administrative Associate for Diversity and Inclusion Programs at El Paso Community College. Currently, D&I is under the direction of Dr. Peña, Executive Director for Human Resources. Joining us today, we also have Lee Vasquez, Coordinator for our program. We would like to take this moment to say thank you to our Black History Month Committee, Shonique Torrance, Antonio Rodarte, Curtis Smith, Monica Tucker, and Anthony Robinson. We wouldn't be able to have this great discussion or events without them. Today's moderator is Shonique Torrance. Shonique Torrance is a proud single parent, daughter, sister, friend, military veteran, entrepreneur, community volunteer, women peer leader, parent and family engagement, and substitute educator. She is the type of person who wants to bring the love and passion she has for El Paso and everyone. Moving back to El Paso in 2015, she started to volunteer with the Socorro Independent School District, and she is currently a substitute with Socorro Independent School District. Not so soon after, she started her entrepreneurial journey as a travel advisor to plan family trips and getaways for herself and others. Wanting to give back to her fellow woven veteran, she became a woven peer leader by the offer of the Stephen A. Cohen Military Family Clinic at Endeavor, El Paso, Texas. Woven helps women veterans to connect with other women to build friendship and sisterhood in person and online. Shonique spends her free time cheering on her daughter as she competes sports while representing Pebble Hills High School. She also engages with her woven sisters, conducts interviews for Black El Paso boys, collaborates with EPCC as a member of the Black History Month Committee, MLK Committee subcommittee member, and is committed to staying actively involved in her community. We welcome Shonique Torrance.
Thank you so much for that awesome introduction, Luz. Appreciate that. With much love from El Paso Community College Diversity and Inclusion Program. Welcome, 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 everyone. Our time is so precious, and I'm so thankful that we get to talk about this very important topic in the Black community. So without further ado, let me just go ahead on and throw some things out there. We've got diabetes, we've got blood pressure, we've got hypertension, PCP, mental health with a varied of different types of diagnoses. I'm throwing that out there to our people who are here on this platform before I introduce our expert panelist. So without further ado, I will have an introduction of, I'll call you Lady Melissa, if that's okay. Lady Melissa Lagunas. She's a registered faculty instructor at Rio Grande campus of El Paso Community College. She works for Texas Tech as well, 2 home health agencies as well. She's worked at DSMC and is a mother, baby nursery, NICU, which they say NICU, and OBGYN. At UNC, she worked as the administrator on duty, corrections RN, supervisor for mobile unit, bed accommodations, mother/baby, NICU and nursery, and doing home health which does allow her the flexibility to reach families and patients in developing a team-oriented plan and facilitating patient care. She's been working in the healthcare field for over 22 years. She has 5 children, of which 3 are boys and 2 are girls, 3 grandbabies, and 5 Boston Terriers. Fur babies, fur babies. And she lives in El Paso all her life, except for 1 year where she took a little break when she lived in Silver City, New Mexico, the land of enchantment, when she was younger. Welcome, welcome, welcome. Next, we have our Mr. Tyrone D. McDuffie Jr., background I see, LPC. He is a licensed professional counselor who believes that there should be no negative stigma attached to a person seeking help for mental or behavioral health related to problems. He specializes in treating patients with depression, anxiety, PTSD, and anger management with a focus on stress management. Mr. McDuffie has found through his experience with many of his patients that suffer from mental behavioral health related problems that overwhelming stress and the lack of healthy stress management techniques is a major contributing factor. He is a certified stress management coach with the Spencer Institute and certified anger management coach with Century Anger Management. He is a host, motivational, and keynote speaker in El Paso, Texas, and surrounding areas. He served our country honorably in the United States Army from 1993 to 1998 and is a proud military veteran. He has a Bachelor of Science in Criminal Justice from 2010 from Park University and Master of Arts in Counseling in 2013 from Webster University. His postgraduate supervision was completed at the Army Continuing Education Services, ACES, Fort Bliss, Texas, and El Paso Behavioral Health System in El Paso, Texas. He is always motivated about helping people live better lives through counseling, coaching, and consultation. So the 3 C's. Welcome, 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 both of you. And let's get started about this juicy, juicy topic. So I'm going to ask the first question, and it's up to you if you want to take a jump at it, and or if I'm feeling it, I'll go ahead on and say who needs to take it first. So the first question is, do you think that it is a stereotype that Black Americans feel when they seek mental health assistance? What has been your experience?
Well, if you don't mind, I'll jump in and I'll answer that.
Thank you, sir.
Well, my experience is that absolutely there is a negative stereotype attached to African Americans seeking help when it comes to mental or behavioral health. I'm 47, so I don't consider myself old or young, kind of in the middle. But I do remember when they say, "Oh, don't mess with them down the street. He's crazy." Never said that he had a problem with anxiety or a problem with depression or he was autistic on the spectrum. We never heard those words in the community. We just heard, oh, he crazy. Don't you hang with that crazy person or you'll be crazy too. And that's what I try to do through my teaching. When I talk to young people or I talk to a group of teenagers or kids or even talking to adults for that matter, I try to make the situation always light, but I make it important that we get the point across that you should and you have the ability, and there should be no stigma attached to you going to seek help because we all live in this world and we all have feelings and emotions. And if you're living, you're going to experience all of them. So you're going to be angry, you're going to be sad, you're going to be happy, you're going to be confused, you're going to be anxious, and all of that is normal. What I tell them is when it starts impacting your daily living and your ability to get through the day, then yes, you like anyone else should go talk to someone else. And I share my experiences with everyone to let them know that I even talk to someone because we all need to get burdens off of us and not carry them on us. So absolutely, there's a stigma attached and a stereotype attached that's negative to African Americans seeking help. They see us as weak. We see each other as weak. And we have to get past that and understand this is about growth and this is about our development. And ultimately, this is going to be about our survival as a people.
So thank you so much for that. So talking about the normalcies of life and the many things that come with that, Lady Lagunas, can you share your experience, please?
Oh, yes. I think mental health is very much overlooked, like you were saying, Tyrone. The stigma, the negative like look as to, oh, well, yeah, they're crazy, they're this and that, and a lot of people don't see the why these things are happening and what is internal to them, what issues do they have that's causing them to feel the way that they feel. That stigma or that stigma of weakness, right? Like Tyrone, you were saying, for not being able to just stick it out and be tough and be better than that and be normal. um, and I definitely agree. I mean, I've also done some mental health nursing. I've taken students to the different UVH psych center, things like that. And these people, they just want to be talked to. They need to talk to somebody. They need to be heard. They need to see what is going on and find that understanding. They're not crazy. They're not psycho. They're not, any of those kinds of, bad words that people use to judge them, to characterize them. It's not about that. It's about understanding what it is that's going on and being able to find the strength to be able to get that help that you need and to overcome that stigma and those the prejudices that go with it.
Thank you. Thank you both. Good answers. Very good answers. So I'm hoping that everyone on this platform today, they're taking notes because there's some good nuggets coming out. And it's to paint the picture of what it's like, what Black Americans experience in regards to mental health. So shake that pen. Make sure that ink is in there. Let's go. Let's go. Let's go. All right. The next question. As a family member, now just picture, we're looking at a Black family. As a family member, what suggestions do you have to refer a family member to seek mental health? Eeny,
Well,
meeny, miny, mo.
well, I'll answer. There's no problem. I'll answer. I actually have a Black family, but let me answer. And I work with a lot of Black families, and I do this talk show I do every Monday, which is Monday's Mental Health Minute. And what I always tell families to do is you have to be involved and engaged in each other's lives. We have to get back to sitting at the tables, talking to each other, and understanding what makes each other tick. And then when you do talk to a family member that needs to seek mental or behavioral health, you want to let them know that there are counselors that are African American. There are counselors that are female. There are counselors that come from the inner cities or they've been at the tree just like you have. So they're not foreign people. They're not different. They come from your communities. They come from your neighborhoods. They lived in your environment. So I can talk to a young man or a young woman that's from the inner city. I grew up in the inner city. So I understand the pressures of what you deal with. I understand the violence. I understand some of the things that you see at a young age that you shouldn't be exposed to. So what I tell families to do is if you ever have to take your child or your spouse or significant other and they need to see a counselor, first you want to have that conversation as a family, letting them know that we're not judging you on this. We're not going to treat you differently on this. And we still love and support you. We just want you to get better and we want you to be the best version of yourself. Then I tell them, screen the counselors. Because just like anything else, you don't just go to a store and say, I'm going to shop here. You find out, is that a good store? Do they have quality products in there? Do they give great customer service? Do they treat you the way you feel you should be treated? Well, you should do your same diligent research when looking for a mental health professional. And then if you want someone that is African American, look for African American counselors. We are out there and we do, have sometimes a better connection when we deal with other African Americans. But if that's what you're looking for, you look for that because I want them to get the best experience out of getting care and getting help so they don't blow it off and say, well, this stuff don't work. I don't want to be bothered with it. So a lot of it is doing that search and doing that research in the beginning. And of course, if they ever reach out to me on Monday's Mental Health Minute, or if they ever go to my website and leave a message, I even help with referrals. And that's even if they're not in the city of El Paso. if they're anywhere within the state of Texas, I would help them find a referral so they can find a mental health professional that they can be comfortable with.
Love that. Love that. Definitely. Networking is so powerful, and the information and referral process is golden. So, Lady Lagunas, if you can share your perspective on this as well, that'd be greatly appreciated.
Thank you. Yes, definitely. Family needs to be involved with helping the patient or the person, the family member, in being able to find that better self, to be able to enable that person into finding and utilizing the help that is available. Something that I tell my students is there's in mental health, taking care of a patient. Okay, because I'm a nurse, I say a patient. There's pillars that a patient needs to have to be able to support them, to be positive, to be able to move forward, to be able to advance, and not keep falling into this cycle, this vicious cycle that they keep falling into. One of those pillars that I say that we talk about is the medications. A lot of people are on medications. Another one is the counselors. Of course, we need the counselor, somebody to talk to, and a great foundational pillar for these people is family, because they need to have that support. They need to have that love at home and that kind of understanding. And I know that a lot of people that we see that are, wandering the streets, and ones that are in the mental hospitals and stuff, they say, my family kicked me out because they couldn't handle me anymore. They did this, they did that. But we need to be able to find a way to get these families back together, to find that support for each other, and let not only the patient have that support and that understanding, but as the family as well, whether it be one-on-one counseling with the patient and then also with the family, because these are the ways that are going to help the person be successful and find that stability and find that sense of belonging and being part of the community. And there are programs also, like if they worry about finances, there's a lot of programs that are out there that'll help people financially. There's grants, there's different things, because I know a lot of insurances don't cover too much, because it's not, I don't know, I think from what I've kind of seen, insurances don't really cover too much of mental health, or it's very limited. But there are programs that are out there that will help and will assist in being able to get the help that is needed.
Awesome, awesome. And so true. So is there a way to share that information? Maybe not at this time, but maybe if we can send it to El Paso Community College, Lee or Luz, so that way they can get this information out to the masses, because there's a lot of people who have not been able to find that support, or they may not have the family support. Looking at the picture of the Black family, in comparison to what's going on in El Paso, we are the minority. So if we're the minority in regards to numbers, we don't necessarily have a large family. So if we don't have that family support, what resources can you kind of name 3 off the top of your head as to who or what they can tap into to start the process for that support?
I think the place that I've seen, and I will say the Child Guidance Center, I know, is one place that they have an application. It is a little bit of a process, but they do have access to funds. I'm not sure, like, a complete, big list. My specialty is not specifically mental health like that, but I know different counselors, different agencies or different entities have those kinds of resources available. Also, the mental health nurses going into like a psychiatric hospital, seeking that assistance, and there's counselors that are there that are able to find that whatever assistance that is needed. And the long-term care, placement of housing placement, food, shelter, clothing, things like that. It's just being able to know where those resources are.
Awesome. Thank you so much. Mr. Tyrone McDuffie, please
Yes.
add your response.
Well, there's various centers, but it really depends on a lot of times a person's status. If a person's a veteran, the VA, El Paso VA is always available to them. Family Endeavors, Emergence does free counseling for veterans. We know a lot of our homeless population is veterans, but Emergence has free counseling for veterans. So there are places to go. The main thing is just always plug into somewhere. And then of course, if we're talking about a family unit, I always suggest that a family unit always start off with their primary healthcare provider if they see that as a problem. Always if it's with the children, deal with the guidance counselors and the counselors at the school first. Always use those as a point of reference first, and then expand your search or expand to what you need based on what's not working or what is working for you. Because the way I look at the counseling is kind of holistic. So you might get somebody that helps you through that crisis or that emergency, but that's all they're supposed to help you through. You have to get someone else to help you get to the next point. So you don't look at a counselor as that this is my counselor forever. This counselor might just be adapt to get you only to a certain level. Then you have to get you a new counselor that gets you to the next level. So you always want to be looking at what's available. But family endeavors, El Paso VA, Emergence, those are always great places to go. El Paso Behavioral Health for any type of emergency. You need immediate intake and need somebody to be hospitalized. Those are always the places that someone can go like right away.
Thank you both for those responses. Everyone okay? All right. No breaks here for the note taking. All right, here we go. Let's move on to earlier on. We were talking about, or it was mentioned, the diabetes, the blood pressure, the hypertension, things of that nature. Can you share with me the connection that those things have to mental health in the Black community? Lady Lagunas?
Yes, definitely. High blood pressure. A lot of people don't realize they have high blood pressure until they're told that they kind of have high blood pressure. And a lot of people don't have access to those medical services to be monitored or to be able to be seen and find some kind of control. And the same thing with diabetes. Only when they're really sick, that's when they find out. When they go to the ER that something has happened or something's going on. That's kind of a pattern that we kind of see in this community. People do not seek out, primary care. They don't have regular checkups, regular assessments or things like that are done until something bad happens. So once you get diagnosed with these kinds of things, there's a lot of mental health that's involved, right? Shock, a lot of denial, right? Denial, like, no, I don't have this. I've been fine and I've been feeling fine forever. And next thing you know, you have a stroke because you don't know. I mean, that's something that is that can be caused by the high blood pressure. Again, stigmas that are attached to finding being taken care of and getting yourself checked up. I know my dad has my dad has diabetes, and he said he kind of is like, no, well, I'm fine and I don't need to this and I don't need to that, and things like that, because he has that sense of, as a man, I have to be in control of the house and I cannot be weak and this and that. But he doesn't see that this is why he's not as able to do the things that he's used to doing. And I know he has moments where he feels kind of less than what he used to be when he was younger, right? So mental health, diabetes, high blood pressure, things like that. There's changes in hormones that are involved, which can cause the depression, the anxiety, the denial, things like that are going on. And like I said, when something really bad happens, like when somebody with diabetes uncontrolled goes into the hospital and they have to get their foot amputated, that's a whole other, realm of mental health that has to be addressed, right? Because they just lost a leg. And they have to deal with that. So there's a lot of things that need to be addressed. Hopefully, we want to get that sooner rather than later, so we can prevent these kinds of things from happening, and to feel a whole person, to feel that sense of that strength, that being healthy. Diet, exercise, things like that. Those are all ways to help with the diabetes, with the blood pressure, feeling better. And dealing with that depression and those other issues that are kind of going on.
Thank you. Thank you for that. So true. So true. Mr. Tyrone McDuffie, please add, how are those like diabetes, blood pressure, things of that nature connected to mental health, especially through your eyes, just like she just shared for her?
No problem. The way I look at it is like this, being a stress management coach. And when I teach that class on stress management, one of the first things I do is I really talk to people about, well, if a kid is being bullied in school, they're dealing with some type of what? And they usually say anxiety. If a parent is worried about how they're going to make the rent or pay the bill or take care of this or that, they're dealing with some type of anxiety. If a woman is worried about if she's going to be battered or have a domestic abuse situation in the home, she's dealing with some type of anxiety. So I say all of those types of anxiety are stress. Now, there are different types of stress. And then what I do is explain to them good stress, negative stress. And what I do with the good and negative stress, like getting married, that's a positive stress. You're nervous, you're excited, but that's a negative stress. I mean, a positive stress, sorry. But then I talk to them about the negative stress, like being bullied or, worrying about paying bills. Or if you live in an environment that doesn't have the resources for you to thrive, or you live in an environment with poor drinking water, or you live in an environment with, bad communication and have a lot of dangerous things around. You're living under constant stress. Then I explain to them what living under stress and having stress does to your body. See, we think right away, oh, I'm stressed, I'm going to get a headache, or I'm stressed, I'm going to get an ulcer. But the reason you get that headache or the reason you get that ulcer is because being stressed, period, it lowers your immune system. And so when your immune system is weaker, you're more susceptible to all types of physical ailments, diabetes, high blood pressure. The stress helps to bring it on because you're not at your best. And when you're stressed, a lot of times you're not sleeping enough. So when you don't sleep enough, you don't get enough serotonin in your body. That's when your body gets to recover and generate and gets to heal itself. When you're stressed, you're not feeling your best. So you don't have those natural endorphins going in your body where you feel good about life. And so when you carry that depression, you carry that anxiety, and you're not sleeping well, you're actually hurting your immune system. And when you weaken your immune system, what happens is you're more susceptible to get sick. You're more susceptible to get that ulcer, more susceptible to diabetes. So what I teach is people to recognize the stressors around them. And then I get them to make a stress management profile so they understand what triggers their stress and then how to deal with it when that happens. Because ultimately, I want them to be healthier. So if I can have them alleviate stress from their lives and have them look at it differently, then they can look at getting more sleep now. They can look at not worrying so much about that bill, or they know how to deal with the bullying, or they know how to deal with whatever it is that's causing the stress in their life. Now they can have those good feelings or those endorphins, and they'll find themselves getting healthier. We've seen people get stress out of their life and learn to manage it properly. Blood pressure go back to normal. They no longer need anxiety pills because they learn how to manage their stress in a healthy way.
Good nuggets from the both of you. What I heard, honestly, because you guys have both extensive backgrounds, I heard that it's the mindset. It is the mindset and how you said the good M word, manage what we have going on. So I'm so thankful that you guys are out there, that there are resources out there to help people. Here's the next question. So since there's such a broad community of Black folks, I say folks, as people get older or wiser, however you see it, they start to go see the doctors even more often. So how can the encouragement begin for younger people to take it seriously and to go before they start to find out that things are going on with them health-wise?
I think to encourage young people to take a more proactive role in their health is we have to have more forums like this. We have to have more discussion. We have to do more community outreach. And we have to let them know that so many things can be prevented if they're diagnosed early. Like, for example, next month, I know we're in Black History Month. I know we're in February, but next month is March. That's Colorectal Awareness Month. That's my father died of colorectal cancer. So I'm very, adamant about promoting that. And so that's one of the forms of cancer that could be preventable with just getting screenings. So we have to continue to educate people. encourage people. We have to use all our resources, all our skills, and we have to go out into the community and let them know it's all right. And especially dealing with our community, the African American community, a lot of times you won't get a dad or anybody to go to the doctor until the leg is already falling off. So what we have to do is we have to go in there and we have to have these talks sometime, maybe just amongst men, letting them know it's okay. Let's go get screened. Let's go get this checked out. Not because I think something's wrong with you or not because I don't think you're healthy. It's because I love you that much. And I want to see you here for the next 10 years. I want to see you watch your grandkids grow up. I want to see you grow old with your wife when y'all both can sit on the porch. I just want you to be here. And we just have to get that out. And we have to use our other resources. We have to use our churches. We have to use our fraternities and sororities. We have to use everybody we can use as a community to put out the word that we're having these screenings. They're available. They're free to everybody. And I mean, we just have to do it. And we have to encourage them and motivate them to want to live healthier lives.
Thank you. And Lady Lagunas, please add.
I definitely agree. We need to reach out there and get to the schools, get to the colleges. I know we have various groups and clubs and such at EPCC, UTEP, things like that, that are there for the students to help show them, you know, what they need to do and how to take care of themselves. I know they have sexually transmitted STD testing. I'm not testing, education, sex education in schools and stuff like that. They need to be able to be educated and understand, because if we keep these kids coddled and we don't show them what is there, then once they get there, they're going to be like, oh, well, they never showed me, or I never knew. And oh my gosh, it's totally new and awkward to them. But if we start showing them, you know, health education, you know, make that a required course instead of just an elective in high schools, showing them a little bit more in their health education by the nurses, have the nurses be a bigger part of promoting these kinds of educational, you know, instruments and such, having that information out there for the students, that's going to help them kind of be more knowledgeable, to have that educated awareness as to what can happen to them. I mean, if they can Google. They can just, you know, when I was in school, we didn't have our phones. We couldn't Google or nothing. I was still going, you know, through a little paper cards and stuff in the library. They have Google at their fingertips. Have those kinds of things. Find ways to put it on Facebook. I know Facebook is like old now. My kids tell me, but Instagram, whatever it is, just find those platforms to reach those students, to reach those kids that are out there. Because if they don't know, if they don't see it, they're not going to learn. They're not going to understand it. And we need to get them young. We need to get them as soon as we can.
Very true on both accounts. And yeah, we're throwing in the technology and the importance of the screening and the testing and promoting education. Vital, vital, vital tips. So guys, remember with those notes that you're taking, don't leave that out, because it's so important. The other thing is too, talking about, I'm going to shift it just a little bit. I was looking at something, and it was saying that the infant mortality rate amongst Black babies is significantly higher than that of others. So if you can speak on that, Lady Lagunas, and any information that you may have, Mr. Tyrone McDuffie, that would be greatly appreciated.
Yes, we know that statistic-wise, diabetes, high blood pressure, things like that are more predominant in African American communities, Indian, Hispanics. We all have those. We're at higher risk for these kinds of things. In not being able to have access or resources to have good prenatal care or management of whatever issues are going on with the pregnancies, then you know that's kind of like rolling the dice and see what happens. And it's not like that. We need to take care of themselves, especially they're diabetic. Moms can be non-diabetic before the pregnancy, but they can develop gestational diabetes during the pregnancies. And that is something that leads to that infant mortality, because the babies are not taken care of so much in utero with the diabetes, the glucose monitoring, the constant the checkups, things like that. They need to be screened. They need to be watched. They need to be taken care of. So again, educating women that they need to have good prenatal care. They need to see the doctors, not some place that's offering cheaper services or whatever, but somebody that has board approved services, board approved care, doctors, nurse practitioners, all of us professionals that are educated and that are licensed to take care of these people. We need to reach out to them, get the Medicaid if finances is an issue. Find the resources. Go online on your phone and find an OB doctor, somebody to get taken care of, get your checkups.
Thank you. And just to put a twist on it, Mr. McDuffie, because you mentioned the VA and other entities that deal with the veteran population. I know that there wasn't a large platform for women veterans, say 10 years ago, but I'm seeing a good positive movement. So what can you share in the information that you know in regards to your connection with those awesome platforms?
Okay, I'm just going to piggyback first a little bit on what she was saying about the prenatal care, because from the behavioral mental health standpoint, that's also important. Whatever stress a mother is feeling, that stress will go to the child. So we need the mother to not be stressed. We need her to be managing her stress. We also need her to be eating properly. That's another big part of stress management, is having a proper diet. Sometimes, I'm not going to say too much, but sometimes when women get pregnant, they have cravings. And sometimes those cravings are not always the best food to eat. And sometimes you can eat some food that can make you not feel your best. And when you're not feeling your best, then you got to remember that also goes to the baby not feeling their best. And sometimes that's not the healthiest food for you. And then also still, as the mother is carrying the child, getting proper sleep and relaxation is also a big part of that, carrying that child and going through that period of before the child is born. So from the mental health and behavioral standpoint, those are the things that I think a mother can do and a family could do to also help the baby be born as healthy as it can be born. Now, with the women veterans, well, I have to say, I have a woman veteran in my house who's my wife. And, they have made a lot of strides in the last few years for women veterans. One of my good friends, Colonel Hope, she has the Hope Center, and that's a center for women veterans. Right now, I believe they're not open because of COVID, but they have housing. They help them get temporary shelter, clothing, and she just does a lot for women veterans. So there are more people stepping up, doing a lot of great things to help women veterans. The VA itself has a women's health group where the women can go there and they're seen by women doctors, women nurses only. There's no males in that health group, so women can choose to just be in that singular health group. So I think they have done a lot to really recognize the differences with male veterans and female veterans. And I think they're doing a lot more to offer resources to help women veterans with their specialized situations and resources. Now, can more be done? Absolutely. Are we getting on the right track? I believe so, but we still have a long way to go.
Good job, both of you. Goodness, I'm so excited with your responses because it's good stuff. It really, really is. And I am so glad that you guys are here today. My next question is going to be, dun, dun, dun. When do you feel that it is absolutely necessary for someone to seek mental health? Like absolutely necessary. Now, I'm also including the family. We mentioned this earlier. Some people do interventions and things of that nature, but what are the signs? When do you feel is absolutely necessary? Lady Lagunas?
I think when you start not feeling yourself, when you start having maybe like teenagers, having those hormonal shifts, hormonal balances, when they start thinking something's wrong, they start going and looking for that kind of acceptance, looking for their peers, looking towards their peers for that acceptance, because they tend to shy away from parents, right? So I think we should have at least maybe some screenings or some kind of access to mental health, at least through in the high school years, or late middle school, things like that, so that they have that access. And that's just like I'm saying, with the hormonal changes and things like that. But for kids, also elementary school, things like that, we have counselors. There's specialized counselors that are there at the different school districts that are able to help, diagnose these issues or see or recognize the symptoms that are being experienced by the students. It's the expertise of the teachers, nurses, people that are working with these kids and kind of saying, hey, maybe we should, talk to the parents and see what we can do. I know I reached out. I noticed some things with my son. He has ADHD, and I kind of noticed some things, and I'm like, So I reached out to the school, and I know there's some counselors and there's some evaluators and doctors and stuff that are involved, and they were able to do a comprehensive evaluation to see what is going on, what is going on with my son, what is happening, what the experience is of a teacher at home, independent, observation and such. But the schools, elementary schools and such, they do have these kinds of resources for kids to be seen. And, just basically when it's recognized, when we professionals or when parents, we kind of see, hey, something might be a little off. What can I do to help my child? I love my child. I want him to be the best. What can I do? Because this is something I think it's above what I am able to do.
Awesome. Definitely for you, Mr. Tyrone McDuffie.
Okay. When it comes to the issue of when someone needs to seek help, I like to break it down a little differently. So if someone is having suicidal or homicidal ideations, that person needs to be seeing somebody right away. They might even need to go to an emergency place like El Paso Behavioral Health if they already have a plan and they've been contemplating it. So when you're talking suicidal, homicidal ideations, they need to see someone immediately. And I kind of put that in a different category from everything else. Then I come down to if they're dealing with depression, they're dealing with anxiety, they're dealing with PTSD. When we all experience that in our lives, everybody living has had a trauma. We all have. Everybody here has been depressed. Everybody here has dealt with anxiety. But when that anxiety gets to the point where I'm not getting up to go to work, or your child is not getting up to go to school, or your wife is no longer wanting to prepare a meal for the children, and that becomes part of the routine, it's starting to impact daily life and daily living. Or the depression is starting to impact daily life and daily living. Same thing with the PTSD. Then that is a point where they need to be seeing a professional, because now it's impacting their daily living. And that's when it's the most severe. Because all of these ailments, depression, anxiety, PTSD, they all have levels. So they all have moderate, they all have severe. And when it's severe, that's when they really need to be seeing somebody, because it's impacting their day to day. And that's what we want to look for. And then the other category is reckless behavior. So now if you get teenagers or you get your young ones and they're starting to be involved in reckless, dangerous behavior, that's when they need to see someone. They're out there having unprotected sex and they don't care who they're having it with. They're driving cars recklessly, not wearing seatbelts, not worrying about if someone else gets hurt or injured. You notice they got this other type of reckless behavior. Maybe they never ran with a gang before, but now they're hanging with gang members. They're using illicit drugs. That is a sign that, yes, they need to see somebody immediately, because they're involved in reckless behavior that can cost them their life. So with the homicidal and suicidal ideations, yes, they need to see someone immediately. Reckless behavior, when you see it and recognize it, yes, they need to see somebody. And then when the behavior impacts a person from getting along and dealing in their daily lives, they need to see someone at that time.
Thank you both for your responses. I do see a hand up. Lady Lagunas, you have the floor.
Yes, I just kind of wanted to add, being in recognizing those things, like I said, a lot of teenagers, they turn away from us as parents. But teaching our kids that it's okay to recognize those in their friends, and see that, and maybe talk to them about it and see what they can do to help them. It's not just from us as adults, but also kids and their peers, to be able to see those things and to be able to help them, not because they're being snitches or tattletales or anything like that, but because they are the ones that are closer to them, and because they care and they are a part of that group, and they're the ones that are probably going to see things way before me as an educator or a teacher, or stuff before they see them. I think it's going to be more evident among the peers, so they need to know that it's okay as well.
Good, good, good. Love it, love it, love it. All right, so here's my question, because those were very good answers and very truthful. There is something called, or considered to be, the Bible in the mental health world or the medical field, and it's the DSM, the Diagnostic and Statistical Manual of Mental Disorders, DSM-5 now, I believe. So with that big old huge book, I observed that there were differences in regards to diagnoses in the Black community. Can you share what has been your experience, if you've come across that? What has been your experience with that, and share with us why that could be? Mr. Tyrone McDuffie?
No problem. I actually have my DSM-5 right here. We
Got the
do
Bible.
call it the Bible in the mental health field. So we always have it with us. I think the biggest problem is not that we sometimes in the Black community, since we're not represented as much as everyone else in the positions that diagnose, a lot of times certain behaviors of our children get diagnosed when they're not diagnosable behaviors. I'm real hesitant to ever diagnose a kid with anything like a bipolar. I just don't want to do that to a child, because once they get that diagnosis, that's their diagnosis forever. It's always in their chart. So a lot of times that has happened to children in the African American community, where they've been diagnosed and necessarily that wasn't correct. It's not that the book has the wrong diagnoses in here. It's just sometimes, as we said earlier, when you don't understand the community that someone comes from, you don't understand what they have to deal with in their community. And I'm talking about maybe being from the rural South or being from the inner city. It's hard for you to relate and understand certain types of behaviors are not absolutely abnormal. You might have a kid from the inner city, like where I'm from. He might have seen somebody get shot before and dealing with the trauma from that, but he lives with it every day. And so for that kid, he might not even recognize that he's living under constant stress, because to him, that's just normal. That's just Monday. And somebody else from another neighborhood say, man, that was a crazy day. But that's that child's day every day. So sometimes I think it happens a lot because we don't have the same amount of representation. We don't have the same amount of Black and African American mental health professionals. I mean, I'm a member of the Black Counselors Association, but it's not a lot of us throughout the United States. So what we try to do in that association is we try to always promote that there are mental health professionals that are African American, that you can ask for an African American counselor. And I do think it helps a lot when you can understand the background that a person is coming from. It gives you some familiarity and it gives you some understanding, because a lot of times things are cultural. It's not just, oh, I'm a Black counselor, so I'll understand what this Irish person is dealing with, or this Asian person is dealing with. No, some things are cultural, and some things you have to understand culturally to be able to communicate and understand what might be going on with that child, or what might be going on with that mother, or what might be going on with that father, in order to give them a proper diagnosis. Now, a counselor can also do what we call staff. They don't have to make that diagnosis right away. They can call another professional and ask that professional to staff that case with them before they make that diagnosis, where maybe that person could give them some of them cultural elements that maybe they don't understand, and then that can be a different diagnosis for that person. And so I think we just have to get more representation in the field. We have to let our young men and young women in college know that this is a great field and a great profession to be part of. And we have to encourage them to come into the profession because of the great need for them and the great work that they can do in this field.
Thank you for your response. Lady Lagunas, what has been your experience, being that you've worked in different locations in the medical field? You've seen some things. So in regards to the Black community, what has been some of the things that you've seen regarding representation, how it's been presented to the patients, and also on the professional side?
Definitely having to, like Tyrone was saying, having that understanding of where they came from and not having that kind of judgment or biases based on their own, their own experiences, their own values, their own beliefs. In nursing, we try to have cultural relativism. We need to try to understand the different cultures and try to recognize, okay, is this part of a culture issue, or is this something else that is going on here? We try to be more objective in making our diagnosis and addressing the problems and not ruling them out as, oh, they're crazy for what they're doing, or, oh my gosh, can you believe, these kinds of things. Understanding, oh, okay, and trying to learn more about those cultures so that we can find ways to help them, find ways to reach that understanding and build that trust and that rapport with the patients, and not, having that and not giving our judgment into the people. And especially like I said, in mental health, in general, I tell my students, hey, anything that you guys are thinking, that goes out the door, whatever your beliefs and stuff like that. No, you have to talk to these people. You need to see them. You need to understand them and talk to them and see what their beliefs are and see how they feel and what is their understanding of what's going on with what is happening to them. And like that, you have a better perspective, as opposed to that bias kind of like tunnel vision kind of thing that a lot of people have. What's the bigger picture? What are we seeing here, and why? And my students will tell you, I always ask why. Understand the why.
Yes, good stuff, good stuff. Understand the why. And what I heard too was the power of engagement. We should be engaging with each other as well as educating ourselves at the same time, because education is not just in a traditional set. It's also when we come in contact with each other and have that great takeaway. So without further ado, I know I keep saying that's my little catchphrase. Without further ado, I am going to take this time to thank you both for joining us on this platform. I have one last thing, because we talked about so many good nuggets. We talked about screening, we talked about testing, we talked about anxiety, we talked about depression, blood pressure, you name it, we talked about it. If you had a chance to say anything else at this point in time that you didn't get a chance to cover, that you want to cover, please use this opportunity. We know we'll see you again, but please use this platform. Mr. Tyrone McDuffie.
Well, what I like to leave everyone with is this. It's an acronym that I came up with, and it's SWEEP. And so it's real simple. That's get some sleep, make sure you're properly hydrated, make sure you eat right, make sure you exercise, and then make sure you get some personal time for yourself. And when you put all that together, that is SWEEP. And I use that to say sweep all that stress, sweep all that negativity, sweep all that depression, sweep all that anxiety out of your life, sweep it out of your life. So, get you some sleep. And if you're having trouble sleeping, talk to your primary care doctor. You may need a sleep study. Eat right, or start eating better today, and do what you got to do. Get your hydration together, get your exercise together, and take personal time. Take time for yourself, because a lot of times, most of us are out there doing for everyone else. We're carrying the load for everyone else, and we never take personal time for ourselves. So if that's meditating, if that's prayer, If that's going to yoga, that's taking a hike, do something that is just for you so you can recharge your batteries and be the best version of yourself. I want to say thank you for having me on the panel, and may God bless you all.
Good stuff. Lady Lagunas?
Number one, we need to find, everybody should have a primary care provider that is able to help show us the resources that are available. We're seeking out these the resources that are available in the community, because there's help out there. There's help out there. It's just being able to find it, having the mentality to say, I am done being this way. I don't want to be this. I want to be better. I want to be awesome. I want my kids to be awesome, and taking that step forward and doing better and achieving those goals. Make little goals, achieve that goal. Okay, next goal, I'm going to do this. Next goal, you might say, okay, I'm going to eat less. I'm going to eat maybe half of my plate today, what I usually eat. Okay, so I did that for one meal. Okay, so now I'm going to, finding those little goals that you can set for yourself day by day to be able to say, hey, where was I a week ago, a month ago, a year ago? And look at me now, and being able to take that step. Starts with a PCP, primary care provider, nursing staff. Just reach out to somebody and get that help you need, because we're out there. We're there for you, and we will make it happen for you. But it's a team. You need to be part of that team, and we'll get it going.
Good job. Good job. Love it. Love it. Oh my goodness. I wanted you to see my happy smiling face as I thank you both for gracing us with your presence as well as your wisdom. I will now turn it over to the hands of El Paso Community College, Luz Avila. Thank you guys again. We really appreciate you.
Thank you, Shonique, and I agree with you. Thank you, Mr. McDuffie, Ms. Laguna, for sharing your knowledge with us. I would like to take a moment to also say that we will be offering the Black History Month Scholarship, and the deadline is until March 31st. So this is a great opportunity for students to take for a scholarship. Also, in our previous discussion panel, we had a vegan dish video by Miss Melody Henderson. Here's her information if you would like to check it out. We will also be sharing the link in our chat. Also, celebrating Black History Month through art and conversation. Carla Zanelli from El Paso Art Association, she interviewed two local artists, Alice Ada Ayers and Michael Novotny. So we also have the link here for the interview. Also want to take the time to invite everyone. We will be having our Women's History Month coming up next week already. We will be having 4 presentation every Wednesday during the month of March. We will be having Iris Lopez from Hija Yes You Can, Susie Zambrano, Niora Garcia, and Leticia Arellano. So please join us for Women's History Month too. And we are diversity. Here is our contact information for Dr. Andrew Peña, Lee Vasquez, and myself, Luz de los Reyes. Follow us on social media, Facebook and Instagram. Also for future workshops or events, please visit our APCC website, apcc.edu/services/diversity. Thank you very much.
Thank you all.
Thank you.
Thank you for having me.
Thank you. Bye, everyone.
Yep. Melissa, thank you so much. Shonique,
Yes, sir. Thank you.
great job. Luz, Lee, everybody else, Tony, Curtis.
Thank you.